The next hour, News 8 will be putting the facts first, taking your COVID-19 questions, and we have received a lot of them, and putting them to our local leaders. As Maureen said, we have in our studio right now Monroe County Executive Adam Bello and Monroe County Commissioner of Public Health, Dr. Michael Mendoza. So I want to thank you two for joining us. We are at a crossroads in our area. Our infection rate remained notably low for months, and now we're seeing those numbers start to creep up. Just today, there were 66 new confirmed cases of COVID-19 in Monroe County, and it's of course important to remember that more than 300 people have died from this virus just in Monroe County. A reminder to keep at it. We're going to start this town hall with opening remarks. We're going to begin with County Executive Adam Bello. Mr. Bello.
Good afternoon. Thank you, Adam, and I want to start by thanking everyone here at WROC and Adam Chodak for hosting tonight's town hall, and all of you at home for taking the time to tune in. Our community bought into flattening the curve and slowing COVID-19 spread, and I want to thank everyone for their efforts during these long 7 months. I also want to thank my friend and colleague, Dr. Mike Mendoza, our Public Health Commissioner, and his dedicated team at the Monroe County Department of Public Health for their tireless efforts over the last 7 months. There's a new phrase that's being used by people. It's called COVID fatigue. It's real. We're all sick and tired of this. We're tired of wearing masks. We want to see our loved ones, and we want to be able to enjoy a night out for dinner, go to a concert or a sporting event, and we all want life to go back to normal. Unfortunately, we're just not there yet. We're not through this, and we have to recognize that. We have to acknowledge how far we've come, but we also have to acknowledge how much further we have to go. Let me be clear. We will get back to normal, and that's the good news. This will go away. We just don't know when. Earlier this year, we made a lot of sacrifices. Since March, we've lost over 300 lives in our community. Thousands of people have become sick, and countless businesses have had to close. COVID-19 has impacted all of us in different ways. There are people watching tonight from home who have minimally experienced this pandemic. They've continued to go to work, their kids are back in school, and they've been able to go about their daily business. But there are many others in our community whose entire livelihoods have crashed down around them. They've been sick. Family members have been sick. Perhaps they've lost a loved one, or they haven't been able to see their loved ones. They've been furloughed or lost their job and are struggling to support their families. We cannot lose sight of the cost of this pandemic and cannot lose empathies for our neighbors. Now that we're heading into the fall and winter, we've seen an increase in our COVID cases and our positivity rate. But we know so much more than we did at the beginning. We've learned important lessons and must continue to follow what worked to flatten our curve. We must follow the science. Sitting at home, many of you may be thinking, what does this have to do with me, or what can I do to help? Well, it's what we've been doing as a community. We should be wearing a mask while we're in public, maintaining good social distancing of 6 feet or greater, and regularly washing and sanitizing our hands. And now is the time to get your flu shot. The last thing we need to see in our community is a dual pandemic. Flu shots are available now, and that's how you can contribute to our community health. We've been in this together for 7 months now, and our only way through this is to continue to work together as a community to keep our curve flat. We're at the beginning of another challenging period, but Monroe County is strong, and I am confident in our capacity to keep up this fight, and we will get through this together.
All right, County Executive Adam Bello, we thank you so much for that. We're going to turn this over now to the Public Health Commissioner here in Monroe County, Dr. Michael Mendoza. Dr. Mendoza, you have the floor.
Thank you, Adam, and thank you again to all of the WROC team and to all of our local media for your diligence throughout these difficult and turbulent months. Tonight, we find ourselves in an eerily familiar place. 7 months ago, we were looking ahead to St. Patrick's Day and the spring, amidst a new and uncertain threat posed by this novel virus. Today, we are again looking ahead, but this time at Halloween and the holidays, with a very familiar yet very different feeling of uncertainty. In March, as a community, we acted swiftly, canceling the St. Patrick's Day parade, closing our schools, and shortly thereafter closing businesses and our economy as we knew it, entering what by every measure were among the most dark and difficult months in our recent times. To some, we acted too soon. To some, we did not act soon enough. To some, we overstepped, and to others, we fell short. We did a lot of things well, and we learned a lot about how we could have done things better. Although many of us have lost loved ones along the way, and although many of us have lost their jobs and endured threats to our livelihoods, in spite of all that we have sacrificed, here we are, in many ways, lucky to be alive right now. And yet, for all of the comparisons between now and March, we are in a very different place. Today, we know more about this virus. We are better at testing and treating, and a vaccine is on the horizon. We know what precautions to take. We understand the value of masks and of social distancing. We know they aren't perfect. No preventive measure ever is. Yet we know that if we all do our part, we stand a better chance of protecting ourselves and one another and decreasing the chance of needing to take more drastic measures in the near future. For now, although we are seeing an increase in cases, we are not yet seeing a dramatic rise in cases among the most vulnerable among us. And still, there is so much yet to learn. We are working to understand immunity to COVID-19, and we are still researching the long-term effects, if any, of contracting this infection. Most importantly, we know the value of coming together, and we know we can do this. And unfortunately, we cannot quit now. The COVID pandemic is not going away anytime soon, and unlike before, today we are tired. Fatigue with this pandemic is very real. We all want this to be over. We all want to reconnect with our loved ones in the months to come. We all want normal again. But this virus has no empathy, so we must beat it. We beat it by being present with one another, perhaps in new and different ways, and with even greater intensity and gratitude than we have ever had before. We beat it by listening to credible sources, following the science, and putting our preconceived platforms aside. We beat it by asking questions and by listening, so we can find meaning amidst the uncertainty. In this way, seemingly scary facts need not necessarily give rise to fear, but rather to clarity. With these facts, we can each make better decisions about the risks and precautions we will take, with our own needs in mind, ever mindful that we all live in a community where our actions can greatly enhance or undermine the lives and livelihood of our neighbors. For months, our low COVID prevalence rates have allowed us to reopen parts of our economy and our community. We have enjoyed a glimpse of normalcy. We have proven that by coming together, we can achieve among the lowest rates of COVID-19 for large counties in the United States. But as COVID rates rise, as they are now, we can no longer take the same things for granted. What might have been less risky 2 months ago is much more risky today. The precautions we took before will need to be readapted to a new and ever-changing reality, and we can shape what that reality looks like. Our actions today will determine our outcome as a community. We will again be faced with many hard choices, and now is not the time, unfortunately, to be complacent. And so tonight, let's renew our commitment to understanding the facts, and more importantly, let's renew our commitment to one another. We have what it takes to do it again, and I know it will be hard. And I am confident that with continued conversations, we will come through this even stronger and more together than before.
Dr. Mendoza, thank you so much. And again, thank you to County Executive Bello for your opening remarks as well. We're going to get to the question and answer section of all of this right after this short break. Stay with us. Welcome back, everyone. We want to get right to those questions in this News 8 Town Hall. The first question is going to be directed towards Dr. Mike Mendoza. Dr. Mendoza, you mentioned, and this is good news, that the vulnerable population is seeing less when it comes to COVID-19 cases, but we are seeing younger people get it in their 20s. So the question is this: A, is this a college problem? And B, as Paul asked on Twitter, if they are contributing to this, what steps should they take as they go home for Thanksgiving break or for winter break?
Well, overall, we are doing well. We are entering this fall and winter phase with among the lowest rates in our area. And at the same time, we are seeing increasing numbers, particularly among individuals in their 20s. And many of these individuals are college students, but not all of them. But what we do see is a consistent theme of gathering, larger gatherings, more frequent gatherings, and almost universally not using the precautions that we are recommending. And so while we look at the progress that we've made as a community, we need to pay attention to this very important population because they may present further risks to other parts of our community down the road, namely older individuals and people with medical concerns. Now, as for those who are in college, our colleges have really stepped up and have offered lots of guidance to the students, educating them, encouraging them to do the right thing, and they've implemented very rigorous testing procedures, both on their way home as well as for their return. But the most important thing our college students can do are be mindful of the risks that they're taking, whether they're here in our community or at home in their hometowns. To be thoughtful of all of the things they're doing in those 2 weeks prior to their return to our area. You know, those 2 weeks are the most critical because it's during those 2 weeks that they might acquire an asymptomatic infection and inadvertently bring it to our community. And so, as we'll talk about later on, as the holidays come along, when we think about traveling anywhere, we want to be thinking in terms of what are we doing in those 2 weeks prior to our travel, because that's that window of opportunity where we might acquire an infection that we don't want to share with our destination.
All right, Dr. Mendoza, thank you. The next question is for County Executive Bello, and the question is this. You painted the picture of what the economy looks like. You have some people who are continuing to do well, they're working from home. Others are suffering. So what financial assistance programs or help is out there for them locally?
Well, thank you, Adam. And true, the economic health of our community is one of my top concerns right now, as it goes hands in hand with our public health. And in many ways, small businesses in our community are the lifeblood of our economy. They employ an awful lot of residents in our community and are the economic engine that drives and keeps us moving forward. Earlier this year, our small businesses, restaurants, things of that nature made a lot of accommodations and made a lot of changes to their operation in order to stay open. And as we head into these winter months, it's going to be harder and harder for those businesses to be able to make those adjustments to stay open and keep employment going and keep the economy going. So what we've done is last week we announced a $15 million program, thanks to the CARES Act funding that Monroe County received, to help our small business community, specifically those with employees up to 50 people or less. And the way this grant program works is that for a business that has between 1 and 2 employees, they're eligible for up to a $10,000 grant. For 3 to 25 full-time employees, up to $15,000 grant, and 26 to 50 employees, a $20,000 grant that can be used in a very broad way in order to meet the needs of each individual business so they can continue to operate over the next several months. The application process for those loans or for those grants is still open. It closes on Monday, November 2nd, and you can visit monroecounty.gov, www.monroecounty.gov/fastforward Monroe to see all the full details of that program and for the application. In addition to that, Monroe County has worked collaboratively with Rochester Chamber of Commerce and Greater Rochester Enterprise and Rochester Works to create our employment portal to help link individuals in our community who are looking for employment and businesses that are looking to hire. You can access that portal again through our website at monroecounty.gov, and it's a real great unique partnership to help marry those who are looking and those who are seeking, so we can bring those two together. In addition to that, if there's business owners who are watching the program now as well, earlier this year we helped with the distribution of PPE in order to help our small business community in particular meet those guidelines set up by the state to remain open. And we did that in response to the shortages of PPE that we've seen around not just our community here, but around the country. If you are still seeing shortages of those PPE, that can still be made available to businesses by calling our hotline 753-5555 or our email address covid19@monroecounty.gov.
County Executive Bello, we want to thank you. We're going to take a short break. When we come back, I'm going to ask the question a lot of you are asking right now. What should you do on Thanksgiving with the family and the friends? That's coming up. Stay with us. Welcome back. The next question goes to Dr. Mendoza. Dr. Mendoza, this one comes from Amanda. What have we learned when it comes to contact tracing?
Well, thanks for your question, Amanda. We have done a lot of contact tracing so far this year, calling over 10,000 individuals in our community. And throughout that process, we've had a lot of conversations, and we've learned, first of all, we're not seeing transmission. And in general, we're not seeing transmission in our K through 12 schools. Our K through 12 schools in many ways serve as the gold standard for how we can go back indoors and to do so safely. We're also finding that we're not seeing very much transmission outdoors, particularly when people are wearing their masks and keeping their distance and keeping gatherings to a manageable size. But by the same token, we are seeing some very concerning trends as we start to move indoors. Although schools are very safe, what we're learning are the related events may not be as safe. Sporting events, extracurricular activities, even though people may be wearing their masks on the field, for example, we're finding that people may not be as diligent when they're on the sidelines or where they're walking to and from the stadium, for example. We're learning that carpooling has been a concern. Even though workplaces have been very safe, it's that getting to and coming home from work that may present a risk. And we're also seeing more gatherings of larger people happening more often among a minority of our community. And so we know this because as we look at the number of individuals who we contact per case, on average, that number has trended upwards in the last month. And so we're learning a lot about the things that we need to keep continuing, staying outdoors as much as we can, wearing our mask whenever possible, and we're also learning about some of these concerning trends as well.
Dr. Mendoza, thank you. This is closely linked to my next question, and it comes from Yankee Girl on Twitter. We generally have a large family Thanksgiving gathering with approximately 25 people, she writes. How many people are considered relatively safe? This is gut-wrenchingly hard. This question is for County Executive Bello.
Yeah, this is a gut-wrenchingly hard question to answer. And I think the way to address this is talk about, I think, risk. And what is the risk and why are the safeguards in place? You know, we've had these hard conversations with our families going back to Easter, Memorial Day, 4th of July. How do we celebrate holidays while minimizing risk and keeping our family members safe? Over the last 7 months, we've learned a lot about how the virus, what the risks associated are with the virus and how it spreads, particularly when we're in close contact with other individuals. That is why over the last several months, the guidance has always been to, if you're outside with other people who are not part of your core family unit who you live with, it's to wear a mask and try to stay 6 feet apart and sanitize. But you can also, obviously, with your family inside your own family unit in your house, live without your mask and be close to each other. The problem is that the more people you bring into your home as we start to move inside when we're thinking about Thanksgiving dinner, is every person that you bring into your house that's outside of your tight family unit, the risk level increases. You're bringing more people into that environment, particularly indoors. And I want you to think about it as the positivity rate. While you're watching TV and you see a 2% positivity rate, when we're doing general community surveillance, what that generally means is that 2 people out of every 100 that you come in contact with statistically could be carrying that disease. So the larger the gathering that you have, the more likely it is you're going to trip up on that 1, 2, 3, 4 people who are inside that circle being close to you to spread that disease. So we always have to mitigate what that risk. The other problem that we need to address is what Dr. Mendoza has been talking about in terms of the ages of the kids and who's becoming infected. As we start to see those young people, right now we've been protecting the older folks and people with who have medical conditions, but as we look at the young people and the infection rate there, when you're looking at people in their 30s, their 20s, and the school-age children, as the prevalence starts to increase amongst that population, and then we introduce older population, we introduce people who are sick into that environment, the risk factor starts to go up. So you have to take a look at that as a family and have that conversation and weigh what those risks are. Who are we having over to our house? How many people are coming over to our house? And as you look at that infection rate, you start to see a statistical prevalence of that in the community, and you can start to look at your risk factors. So it's something that we're going to have to track very carefully between now and Thanksgiving, and you're going to have to make a decision, just like we did before, as to what is the risk to the people that we're inviting over to our house to celebrate that holiday. But I also encourage you to start thinking about how do we celebrate these holidays while protecting our loved ones? Because this isn't a selfish need of protection. This is about protecting our loved ones, the most vulnerable people around us, and it's about protecting the community. So how do we start to also think about celebrating holidays where we can do so safely, where we are wearing masks, where we are keeping a distance, but still staying connected to our family and our friends?
County Executive Bello, we thank you. Our town hall is going to continue right after this. Welcome back. Our Coronavirus Facts First Town Hall begins or returns now with this question to Dr. Mendoza. It comes from Mike Fitzsimmons. He asked this: other than the overlap with flu season, what are other risk factors that seem to make fall, winter so much more dangerous for COVID-19 transmission? And my tag-along question to that is, how effective are masks?
Thanks for your question, Mike. And we know that the coronavirus that causes COVID-19 is related to the other coronaviruses that cause the common cold. And we know that all of these viruses start to have an increased prevalence in the wintertime. And the reason for that is many. One, we're more likely to be indoors, and it's much easier to pass an infection from one to the other when we're in close quarters. Second, when the temperature is low and the air is more dry, the virus is much more easily passed from one person to another. And so in addition to the flu being a separate but very related problem, we anticipate that the coronavirus that causes COVID-19 will also be more problematic. That being said, we know that masks work. We know that they're not perfect, but if enough people are wearing their mask well enough, as a community, we will fare much better than were we to not wear our masks. So as we head back indoors, wearing our mask is the most important thing to remember.
Dr. Mendoza, thank you. County Executive Bello, this question comes from Nathan W. Should we be worried about another shutdown?
Oh, I certainly hope not. You know, as you look at it and you say, are numbers going up? Yes. But we also know a lot more today than we knew back in March when we had to shut essentially almost everything down in order to get control over the spread in our community. And what we've learned, and I think the state's approach, which has been right, is to do more localized and targeting of where positive cases are starting to go up and where you're starting to see the prevalence in the community. It starts with a regional approach. So in the Finger Lakes region, we have our control room that we work with to monitor what's going on in the community and the prevalence. But the new strategy is down to a micro cluster strategy where we're looking at clusters, and how we look at those clusters is to look at what's happening in very small geographic neighborhoods and checking what the positivity rate is. And when a positivity rate trips at a 3%, 4%, 5% level over the course of so many days, that triggers a cluster, which then triggers a more targeted shutdown within specific activities in that geographic neighborhood. So instead of a whole area-wide shutdown, what the new approach that will be going into the fall is looking at targeted micro areas where we can really get to the heart of the problem. I'll analogize it to this. You know, when recently a college in our area had a big number of cases that were found in a dorm facility. It didn't close down all the colleges in our region. Instead, it was a targeted approach at that college to bring everybody to remote learning to get a handle and get control over the situation. We'll be looking at the same thing as we go forward, so hopefully we don't have that big shutdown, but I'll also just remind you all that is all within our hands. We are all responsible for how that happens and what that spread looks like if we don't follow the safety guidelines that are put out by the health department.
County Executive Bello, thank you. Coming up, we're going to hear from News 8 anchor Leah Lando, who came down with the coronavirus. She's going to talk about her experience coming up. Stay with us. Our town hall continues now. We're going to talk to News 8 anchor Leah Lando in just a moment. But first, more questions. The first one for County Executive Bello. We got about 20 emails about this. People asking about bingo halls, whether they're open. If not, when can they open?
Yeah, that's a great question. And let me just say, because I just said this, I grew up playing bingo with my grandmother, and I understand it's a ton of fun, and we all want to get back to that. But unfortunately, right now, bingo halls cannot be open yet. There just is not a safe way yet that the state has been able to identify to be able to manage the opening of the large facilities to be able to mitigate the risk of the spread there. So unfortunately, we're still not there yet. But at some point, hopefully in the future, we keep the spread low, the numbers low, we can get back to the game.
All right, thank you so much. The next question is for Dr. Mendoza. I'm going to ask you about the general situation when it comes to testing in our area, but specifically a group called Common Ground is promoting significantly more antigen testing. It's a faster way to test for COVID-19 as opposed to the PCR tests that are out there. And their take is if a lot of people test regularly, we might feel more secure when we go out in public. Your take on that?
Well, Common Ground is on the right track. To the extent that we can do more testing more widely, we'll be able to get a better handle on the true prevalence in our community and potentially allow us to start opening things up with better knowledge of how we are doing as a community. But the fact of the matter is that right now we don't yet have enough of the rapid antigen tests, and we also know that there are still some limitations with this particular test. The beauty of the rapid antigen test is, number one, that it's rapid. We can get a test back within 15 minutes. But the challenge with this test is that it is designed to be used among people who have symptoms in whom you're trying to rule in the infection quickly. And so the best use of this, and the use that we are putting into place in the health department, is to investigate an outbreak in a congregate setting, for example, in a nursing home or in a homeless shelter, when we have people who are symptomatic where we want to find out that news as quickly as possible. But unfortunately, it's not yet to the point where we can rule out the infection. So Common Ground is right. If we can apply the test multiple times across a period of time, we will be able to reach that same level of ability to rule out infections, but we're not quite there yet. So that is something that we are working diligently on in the health department.
Dr. Mendoza, thank you. We are going to be right back with News 8 anchor Leah Lando talking about her experience with COVID-19. Joining us now as part of this town hall, News 8 anchor Leah Lando. Leah, you and your family tested positive for COVID-19 earlier this month. How are you? A lot of people are wondering.
Yeah, thanks, Adam. We're doing much better. Our good days and bad days for the kids, I have an 11 and a 16-year-old. They got through it pretty quickly. It was about 24 hours of symptoms for them. For my husband and I, it lingers. The nauseousness sticks around. We often wake up in a pool of sweat. I know that sounds gross, but it's the reality of it. The loss of taste and smell, not for the kids, but for my husband and I, that seems to not be going away. We can't taste anything. We can't smell anything. Headache, fever, chills, all the things that you think of when you think of the flu. But with this, it just doesn't go away. And just when you think you're done with it, another symptom hits us. But overall, where we were a week ago, even where we are today is a lot better. So we're thankful for that.
How would you compare it to the common cold or the flu?
Yeah, like I said, I mean, my youngest said, he put it the best. He said it's the flu, but a lot worse because it doesn't go away. Just when you think you're through it, it hits you with another symptom. So I would just say it just lingers a lot longer, I guess, maybe because our body hasn't been subjected to it before. So it just takes longer for it to fight it off, perhaps.
Well, Leah, thank you so much for joining us. We wish you and your family a speedy recovery. And if you want to check out Leah's story, we have it right now over at rochesterfirst.com. When we return, we're going to have more questions for County Executive Adam Bello and Public Health Commissioner Dr. Michael Mendoza. Stay with us. Welcome back to our Coronavirus Facts First Town Hall. County Executive Bello, this question for you. Where does the eviction situation stand right now?
Yeah, no, thank you, Adam, for that question. And I'll go back to what I said earlier. There's a lot of people in our community, far too many, who are struggling as a result of the fallout of this pandemic. And just recently, Governor Cuomo extended the eviction moratorium to January 1st. But Monroe County does have a program in place to help people who are facing eviction to be able to pay their back rent. Again, thanks to the CARES Act dollars, $6 million, of which we've put to a program thanks to our partners, Congressman Joe Morelli, Senators Gillibrand and Senator Schumer. We were able to put together a eviction prevention pilot initiative, which would extend funding to individuals who have been impacted financially by the pandemic to help pay up to 5 months of back rent to help prevent that eviction from occurring. It could not be easier to apply for, though. So if you are facing eviction right now and need help with that past rent, all you have to do is call 211. When you call 211, there is a central screening that takes place there, and then the program itself will then be administered by community-based organizations right in the community. So again, all you have to do is call 211. They will help you through the income eligibility. There are some restrictions around there. Eligibility is capped at 275% of the federal poverty level, which works out to about $72,000 for a family of 4. And they can help walk you through that application process. So again, please call 211 if you are in trouble facing eviction.
County Executive Bello, thank you. We're going to have a last word from our gentlemen who are here right now helping us out, Dr. Mendoza, County Executive Bello. When we return, stay with us. We are going to end this town hall with a last word from our guests. We're going to start with Dr. Mendoza.
Thank you again, Adam, and thank you to all of you who are at home watching this evening. I want to end by saying this to you. First of all, thank you for all that you've done. You have proven that through collaboration, through communication, that we can work together and rise to the challenge of a challenge that we have never encountered in recent history. Please wear your masks. Please keep your distance. And please be thoughtful about the risks that you're willing to take in the days and weeks to come. This does not have to be a cold and dark winter. If we work together, find ways to reconnect, find ways to engage with one another, and to do the best that we can to find that new sense of normal so that when the spring comes, we can find the old sense of normal that we all long to have.
Dr. Mendoza, thank you. County Executive Bello.
Thank you, and I want to again add my thanks to all those first responders, frontline workers who are out there protecting us and keeping all of us safe through this pandemic, and particularly those in the hospital systems and in healthcare. We all need to remember as a community what we've learned over the last 7 months, and now is not the time to give up and to start giving into that COVID fatigue that I know we are all feeling. I feel it, my family feels it as well. Now is the time to double down. As we're moving indoors and things are getting colder, we need to remember why we're wearing masks, why we're keeping 6-foot distance, and why we're doing all these new innovative things to stay in touch, like all our Zoom sessions and things like that. It's not for a selfish reason to protect yourself. It's to protect your community. It's to protect your family, and it's to keep the spread low so that we can continue to open the economy. We can continue to move forward. Our children can continue to be in school, and that we can get through the next several months healthy and safe. So thank you all very much.
All right. Well, thank you, our guests, for making the time to join us and answer your questions tonight. Thank you out there for watching this special edition of News 8. As always, all of our COVID-19 resources and tools can be found over at rochesterfirst.com. And coming up next,